Welcome everyone, this is Jeff Rich from the Burning Archive, and this is my voiceover of my post from the 1st of March. Mirror, mirror on the wall, why does the USA have the worst health of all? If you're listening on the podcast, you can read this full post, including the various images and graphs, as in charts, within the post at jeffrich.substack.com, and you can become a paid subscriber for $5 US a month at Substack, jeffrich.substack.com as well. Okay, the voiceover. Mirror, mirror on the wall, why does the USA have the worst health of all? Through the noise of American leaders attacking Europe, one pure signal can be heard. On average, Europeans live 5 years longer than USA citizens, and they pay much more for their healthcare, endure more risk, and suffer worse rates of disease, all to fail on the fundamental measure of the good life, how long you live. Why are the USA's health outcomes the worst in the high-income world, and given the wealth of this superpower, the worst in the world? It is time for America to look in the mirror and ask, why does the USA have the worst health system in the world? Why are its health outcomes and health care so bad? The Commonwealth Fund asks this question: why is the US healthcare system so bad? In its annual review of health system performance in 10 high-income countries. Mirror, Mirror 2024, a portrait of the failing US health system. And I've got a link to that report in the post, a report from 2024. The 10 countries are Australia, Canada, France, Germany, the Netherlands, New Zealand, Sweden, Switzerland, the United Kingdom or Britain, and the USA. The USA performed the worst by a long way, and I have the chart on overall performance rating where the United States lags its international peers considerably on health system performance in the post. This rating is based on analysis of 5 domains of health system performance: access to care, care process, administrative efficiency, equity, and health outcomes. You can read the details in the Mirror, Mirror report, and it is backed up by the World Health Organization 2013 country report on the USA health system and WHO's data portal on health system statistics. The USA spent the most on health by far. 1/6 of the USA's economy goes to this failing system. And there's the chart of the healthcare spending as a percentage of GDP from 1980 to 2023 in the 10 countries. The latest data is 2023. In 2023, US had a 16.5%, and the next highest was France at 11.9%. Australia was in single figures at 9.8%. And when these two measures are combined in a grid, the mirror is held up to an astonishing outlying failure. And there's the graph from the report showing healthcare system performance compared to spending, with a group of 9 countries bundled together in the top centre of the grid chart, and the United States way in the bottom right. High health spending, low health system performance. In case you missed it, the dot in the far bottom right is the USA. The USA is not an exceptional nation because it stands taller and sees farther As Madeleine Albright once said, it is exceptional because it spends more on health and dies more, as Emmanuel Todd wrote in La Défaite de l'Occident. Exceptionally, among most countries in the world over the last 20 years, US life expectancy has flatlined or declined in some years, excluding the COVID years that affected life expectancy in all countries. Life expectancy is the result of many factors. In the USA, guns, suicide, substance abuse, deaths of despair, poor social security systems, high rates of obesity and other chronic disease risk factors, the legacies of racial segregation, ethnic prejudice and dismal incarceration rates all contribute to shorter lives and earlier deaths. So too does its failing health system and chaotic governments. Unlike some issues that I comment on, I have deep professional experience in health policy. I have known in detail about the USA's health policy failure for decades. I examined in detail the sad story of the spread of opioid deaths in America nearly 20 years ago. One of my final jobs in the bureaucracy was to prepare a report on health outcome and performance measures for the state. Sick America might have shocked high-profile historian Neil Ferguson when he wrote We're All Soviets Now, and there's a link to that article on Substack in the post. But the poor health of late Soviet America did not shock me. Nor was I fooled by Neil Ferguson's explanation of the mismatch between expenditure and outcomes. But like the Soviet system as a whole, the US healthcare system has evolved so that a whole bunch of vested interests can extract rents. The bloated, dysfunctional bureaucracy, brilliantly parodied by South Park in a recent episode, is great for the nomenclatura, lousy for the proles. Meanwhile, as in the late Soviet Union, the hillbillies, actually the working class and a goodly slice of the middle class too, drink and drug themselves to death, even as the political and cultural elite double down on a bizarre ideology that no one really believes in. That quote is from Neil Ferguson, We're All Soviets Now. Neil offers ideological slop, crude economics, bureaucratic scapegoats, and the woke mind virus as a distraction from this deep American tragedy. He then went on to make the case to redirect American social and healthcare spending towards a generational increase in America's gargantuan defence spending. The Commonwealth Fund's Mirror Mirror 2024, a portrait of the failing US health system, was more direct about America's democratic failure to deliver decent healthcare to its citizens. Quoting from the report, despite spending a lot on healthcare, the United States is not meeting one of the principal obligations of a nation to protect the health and welfare of its residents. Most of the countries we compared are providing this protection. Even though each can learn a good deal from its peers, the US, in failing this ultimate test of a successful nation, remains an outlier. That's from the Commonwealth Fund Mirror Mirror 2024 report. The starkest failure is worth stressing. The USA is the only high-income country in the world without universal healthcare coverage. Most high-income countries have had those systems for more than half a century. Many middle and low-income countries have those systems today, but the USA does not. Its peers as failed health policy states are countries like Yemen and Afghanistan, but the USA cannot excuse its failure on the grounds of invasion, bombardment, and sabotage by an external power. It only has itself to blame. Yet the USA seems incapable of fixing this basic problem of 20th century government. I'm curious about what my American readers think about this issue. How well understood in America is America's failure of this ultimate test of a successful nation? And there's a button where you can leave a comment in the post if you're reading it on Substack, jeffrich.substack.com. There are many dimensions to the tragedy of American healthcare. There is a patchwork of private insurance, employer-based plans, and public programs like Medicare and Medicaid. Millions are uninsured or underinsured, creating barriers to care that are both financial and bureaucratic. The Affordable Care Act, Obamacare, improved the situation, but still left about 1 in 10 uninsured and 1 in 4 underinsured. The patchwork causes administrative inefficiency. The complex system is good for insurers and providers, but bad for patients, bad for actual care. Inequality is rampant in access and outcomes based on income, race, and geography. The system of pharmaceutical drug regulation is appalling, contributing to unaffordable prices and the OxyContin scandals of the last decade. Yet for years the USA has sought to undermine Australia's pharmaceutical benefit scheme through coercive trade diplomacy. Thankfully, Australian governments from both sides of politics have refused this poison pill of American free enterprise. Every attempt to fix the problem seems only to make things worse. I will not try to retrace the history of the failures. They go back a long, long way. But somehow the self-perception persists that America offers the best healthcare in the world. For the elite at a luxury price, yes, but a 5-year gap in life expectancy with the despised Europeans does not lie. Robert F. Kennedy Jr.'s slogan to make America healthy again resonated in the 2024 election, but it concealed a lie. When was American health ever great, and is destined to fail? His agenda fights old wars. Kennedy is scarred by the COVID years and too much litigation against Big Pharma. He is not dealing with the fundamentals. Musk's AI-generated spending review, the Department of Government Efficiency, will prune some waste but send the libertarian dogs on all the wrong targets. Health policy is hard. Implementing effective healthcare is harder still. Trust me, I spent 16 years of my life doing it. It tests the most capable of governments and the most effective of political leaders. The USA government and the Trump administration are not up to the job. There is a difficult history question behind this all-American failure. Why has the greatest democracy on earth failed the ultimate test of a successful nation? On Wednesday, my deep dive for paid subscribers will explore that question with the benefit of Emmanuel Todd and a recent history of healthcare in America. There's a subscribe now button in the post if you'd like to upgrade your subscription, or subscribe if you're listening on the podcast. Coming up next week, Barack Obama. And this post is part of my series on America. My full schedule with links to past posts for the World History Tour of World Powers is here as a PDF for you. And so that you can download that PDF with the complete list of all the America posts and the forward schedule for the other countries of the World History Tour of World Powers in the post. Thanks very much, Jeff.